Mr. Speaker, I'm glad to be co-sponsoring this amendment and partnering with Representative Danny Davis once again to continue this important work that we did in sending the Sickle Cell Disease and Other Heritable Blood Disorders Research, Surveillance, Prevention, and Treatment Act of 2018 to the President's desk last December. You know, and all the hubbub of the election cycle in the fall of 2018, it's easy to lose sight on some of the accomplishments, but this was a significant accomplishment of the last Congress. I made a commitment to Mr. Davis at the beginning of the last Congress that as chairman of the Subcommittee of Health on the Energy and Commerce Committee, that I would make the passage of his sickle cell reauthorization bill a priority. This was important. It had been years since this bill had been reauthorized. First passed in 1972. The last reauthorization was part of a tax bill that was signed into law by George Bush in 2004. But in the fall of 2018, after nearly 20 months of work, the House passed their product in February of 2017. The Senate did, and it's to be commended that the other body did act. And Senator Tim Scott of South Carolina, Senator Cory Booker of New Jersey got a bill through the Senate and brought it back to the House, where it was passed and then sent down to the President of the United States for his signature. And President Trump did indeed sign the first standalone sickle cell reauthorization in decades, and this was signed last December. You know, when we had a hearing on sickle cell in the summer of 2016, one of the witnesses, a witness from the Sickle Cell Disease Advocates Alliance, came and spoke to our subcommittee and said it had been decades since the Food and Drug Administration had approved a new therapy for sickle cell. Hydroxyurea decades ago. And then in 2017, the Food and Drug Administration approved Endari, which was the first new therapy in years. And then earlier this year, Dr. Francis Collins went on 60 Minutes and said that we can now use the word cure because of new gene editing treatment that relieves these patients of their crippling symptoms and enables them to lead regular lives. This is a spelling error of 2 bases, a transcription error of 2 bases in the part of the gene that encodes for the hemoglobin molecule. And the National Institute of Health is now talking about providing a therapy for that in fact we can talk about the word cure. So this amendment is a down payment on that cure, and I certainly thank Mr. Davis for his years of dedication to moving these projects forward. This amendment provides $2 million for the Public Health Approach to Blood Disorders program for sickle cell disease and support the CDC Sickle Cell Disease Surveillance Program. Look, years and years and years ago, I worked at Parkland Hospital. I took care of patients with sickle cell, kids that would come into the emergency room in crisis, a very, very painful condition. We didn't have much to offer back then. Hydration with an IV, Thorazine so that they wouldn't climb the walls, and morphine to try to help their pain, but it really wasn't nearly enough. But every one of those painful crises was accompanied by destruction that went on within their bodies because of these sickle cells that were cramped up inside blood vessels and killed kidney cells, killed liver cells, killed bone marrow cells. These kids hurt worse than anything I've ever seen. And now we're talking about providing them the opportunity to lead a regular life. This is powerful stuff. That shows what this Congress can do when they put together their partisan differences. I really do want to thank Mr. Davis of Illinois for his efforts. I mean, he has pushed this issue by himself for years and years. I'm proud to have been a small part of that when we got the bill across the floor of the House and into the office of the President of the United States. I'm proud of President Trump for signing the first standalone sickle cell reauthorization in decades. And now I'm proud to stand on the floor with Representative Davis and see if we can't get just a little additional funding to get this one pushed a little further down the line, because the unbelievable, unparalleled good we are going to do with this. Think of what the cost to this country was for doing nothing for 40 years on this illness. When people say this treatment is going to be expensive, yeah, it's going to be expensive.
Gentleman's time
but what's
has
the cost
expired.
of doing nothing? This is an important amendment. I urge an aye vote on Mr. Davis's amendment to yield back the balance.